Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So I have a question on my neck because I'm trying to figure out whether the symptoms I'm getting show up in the neck or whether they come from the neck. So every time I get symptoms, I get a corresponding experience in my neck, especially in I think it's the suboccipitals, but also in the front. I think it would be the SCM, but I'm not sure. It's just somewhere in the front. And it's especially provoked by doing things with my eyes, such as reading and screen work and stuff like that. But I've been to my osteopath quite a lot, and he says my neck looks good. And I mean, when I leave, I get symptomatic for 2 or 3 days, which you say, Cam, is supposed to be good, but it doesn't really change anything long term. I do, however, experience that I can sort of increase my workload over time, so I do progress. So I'm just wondering whether these symptoms are something that will go away with time, or whether I should have manual in order to sort of remove that obstacle so I can, read better.
So remember, whenever your eyes move, it engages your neck muscles. That's just kind of the feedback loop that's there, right? So we are basically set up that if something is moving over in our peripheral vision, we can look and turn our head in the same direction. So anytime your eyes go this way, all the muscles engage that turn your head that way. When your eyes go this way, same thing. So when you're working on the screen and you're scrolling and your eyes are going up and down and side to side on the screen, or you're reading and you're going back and forth across a page, your eyes are constantly moving back and forth. And so your neck is engaging back and forth. And if you have dysfunction there, you'll start to either experience neck pain, or what a lot of people will experience is a headache. And they will assume that this is related to their eyes. They'll say it's strain, it's eye strain. And it may be, but what's more common is that it's actually just triggering your neck muscles to fire repeatedly. And if they're dysfunctional, it's going to start to cause pain. But people might experience that either as pain in the neck, or they might experience a referred pain into the head. So their headache is actually coming from their neck, not from their eyes. But it's the eye movement that triggers the neck to get tight and stiff if your neck is dysfunctional. So you're going to an osteopath. Yes, it's common that your symptoms will flare up after a treatment, but it's usually only the first, 1 or 2 treatments that this happens. If they're getting to the right spots, generally you shouldn't have any increased symptoms after treatment after maybe the 3rd or 4th one. And then you should actually experience relief from that. So if you're going there and every time you're feeling flared up and it's not really doing anything in terms of progressing you, then you're likely just seeing the wrong provider. So you might need to find a different provider. Again, I would encourage you to watch the manual therapy 1 and 2.
I have.
Okay. And is that what your osteopath is doing?
It kind of looks like that, yeah. He's doing sort of work in the pecs, and then he's doing especially soft tissue in the back. I'm not sure exactly what. And then he's been doing some dry needling and some adjustments. He's not doing the electro thing, and I'm not I mean, I don't remember exactly, but I don't remember him working a lot on the front of the neck.
Right.
So that's the only
Those are the
thing
big ones.
Yeah.
Right. The suboccipitals are usually tight because there's some other dysfunction. When the SCMs are tight, it pulls everything forward and that jams up the suboccipitals. So I can work on the suboccipitals and maybe give you a little bit of temporary relief, but if I don't work on the SCMs, my main problem is still there. So I'm not going to get the suboccipitals are just going to tighten right back up again, because the reason they're tight is not just because they're tight for some other reason, right? So the pecs is great, but if he's not working SCM and not working deep neck flexors, the neck is going to stay forward like this, and that's going to continue to jam these up. Another thing I find with tight suboccipitals is people usually have a TMJ problem, so their jaw. So I've started on every single one of my patients now. I've started going inside their mouth and working on a muscle called the pterygoid, which is kind of up into the back inside the mouth, and releasing that. And that just relaxes the suboccipitals, right away. So if you're not finding good results with this provider, then I would try to find a different provider.
Okay. Okay. So it's not something that I have to work my way out of through screen work. It's actually something that I should seek out good manual care for.
Yeah, I would say
Okay.
because the neck, you have some, to me, it sounds like what's happening is you have neck dysfunction. You go and use the screens, your eyes are moving, it's triggering the muscles to engage. And because they're dysfunctional, it's going to cause these symptoms to come back. So unless you get that kind of neck straightened away, then screens are going to be a continuous challenge for you. And it's not something you can just kind of like work your way out of necessarily. Um,
Okay.
yeah.
That makes sense. I also have a.
Where are you located?
Oh, I'm in Copenhagen, so the nearest clinic you have is like 4 hours away. So that's
Yeah.
pretty
It
rough.
doesn't have to be one of our clinics, but if you can find somebody who if you go on their website and they're, maybe a chiro or something like that, and they specialize in like the treatment of headaches. Like if you look at their website and it says they treat headaches, they're probably generally pretty good with necks.
Yeah.
Um, and like it,
Yeah, yeah, I did find someone with I haven't met him yet, but I looked at somebody doing ART, and you said something about necks and headaches and stuff. So I was kind of looking for those things, but I just wanted to, ask one of you guys first whether you thought it was the chicken or the egg, with the neck and the eyes.
yeah, I don't know which one's the chicken or the egg, but
I don't know
it
yet.
sounds like it's a neck issue.
Okay, okay,
Yeah,
okay. Thank you.
you're welcome.
Can I ask Urkel a question real quick?
Sure.
So I actually posted both these questions. You can just ignore them, but it's because I've been dealing with IBS, and it's never something I was formally diagnosed with. I was just being checked for it, and there was nothing else wrong. So you get this sort of little paper telling you can do food map and stuff, and I've been doing that over the years, and so has my mom. Um, and I've been doing the concussion fix diet for at least 6 months now, and I like it a lot, but um, it's not that my stomach is just zero problems. I still get you know constipation from time to time, and I still feel it sort of vibrating my bowel. So I was just wondering, is this a hindrance towards my recovery? Something I should try to figure out like 100%, or I mean, because I can live with it, and I'm actually doing pretty well just living and eating the way I do. So how
Hmm.
big of a problem would it be, do you think?
Well, I think that if you've been noticing improvements, the question of like the residual effects that you still have, the residual symptoms that you have, is it a problem for your concussion recovery? I think probably the probability of that is low now. I think that now the residual effects most likely are still to do with some sort of very personalized either microbiome imbalance issue or some sort of sensitivity that you have. It's not a necessary. I mean, I don't know if you've tried the whole FODMAP piece, which we had a conversation about earlier today, but I think food sensitivities would probably be the first place to start to see if there's anything else that is healthy and even possibly on the concussion fixed diet list. That's okay, but then it's very personalized. Like for me, it's eggs and dairy, and we both of those are not something that we say you have to avoid. They're both sources of protein, but that's a very personalized thing to me. And so you might have that same personalization to figure out the rest of the GI symptoms. Could that take you to the next level for concussion recovery? Maybe. I don't know. It's worth an exploration, but I think after you've really done the core of the diet, if you've done it for this long, you've probably already achieved most of the benefit that I think diet is going to give you, but it also depends on how much more symptoms you have left. It sounds like neck is a big priority here for you, so I'd make that make that your number one focus, and then if you can find some food sensitivity testing, that could be maybe a good next step.
And I just wanted
Okay.
to jump in there around, we've talked about IBS a couple times in the last hour about the connection between stress and IBS and stress and digestive troubles. So it could be something to just check in with yourself. Hey, is there any stressors? Do I feel like I've been experiencing anxiety, or is there a lot of change? These are some of the things I talk about with my clients, then come to see me and talk about a lot about digestive issues. Is often there's this huge link to stress or life changes, or experiencing pain like your symptoms you might be having with PCS. So these are all important things just to kind of ask yourself, is stress a component of this as well? Sometimes people will actually experience a resolve of their IBS without having to change their diet. In my experience, I don't know if you would echo the same, Dr. Paul, when stress resolves. So just something to keep in mind.
Yeah, stress is a huge component, probably. And I mean, it's one of those things that everyone kind of just like attributes a lot of stuff to. But then when you actually look at the data, the evidence, and the physiology, it actually has a lot of these effects that people do say. And so again, if there's a really strong stress component and you've done a lot of the dietary changes, whether it's FODMAPs, whether it's food sensitivities, whether it's following the Concussion Fix diet, and you're still getting gut issues, but that stressor is still there, whatever it might be, the symptoms, not working, all the stuff that we all deal with, then you can still be getting those symptoms from that psychological side of things rather than just an actual physiological side. I see it over, I'm so glad you mentioned this, Melinda, because I see it over and over that people will have an amplification of any sort of reaction if they're in a state that is overstimulated, nervous system overstimulated, autonomic dysfunction, and also anxiety and all the physiological kind of like patterns that accompany that. So good point, Melinda.
Yeah, and it even goes beyond that, right? Depression or any kind of, disruption in your life. Like there's so many psychological and emotional considerations when it comes to stomach problems and digestive issues. So just not something to be overlooked, because sometimes you can say, hey, I need to overhaul my diet, or I need to, start antibiotics for certain types of bacterial overgrowth. That may be the case, but sometimes the first thing to look at is, well, what's been happening? Well, you're here because there's been a concussion. Concussion disrupts that HPA axis, if I'm correct, Paul. And then you get a lot of this disruption in your digestion. So this is why we kind of place the recovery mindset module first. Can we regulate our nervous system, learn ways to sort of calm down that sympathetic response, which is sort of like a baseline for everyone when you're experiencing persistent concussion symptoms, is likely to have this sort of baseline of stress, this baseline of sympathetic activations. Our nervous system is on overdrive. And then likely you might experience resurgence of flares like IBS. So it's a common story for us. We often hear, well, my IBS was fine for years and years and years. Then I had this concussion. I've been suffering with these persistent symptoms. Now my IBS is back. Okay, well, that makes sense, right? You've had a disruption in the systems in your body, and it can kind of flare up old issues or issues that tend to flare when there's life changes. So going back to that foundation, if you've already gone through the recovery mindset module and you find that, hey, I actually do feel really grounded, I do feel regulated, then move on to things like, is it possible there's, things like SIBO or the bacterial overgrowth that Dr. Paul mentioned, or is it possible that we need to modify diet? Versus kind of jumping to those things before looking at the possibility of having that sort of nervous system disruption or that accumulation of stress or life transitions.
Okay, that makes sense.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.